Hello, welcome to Beginner's e-commerce channel. So today we are going to witness on a DT based activity which is going to be done by our second year BSc nursing student from SNS College of Nursing 2023 batch. So here they are here to discuss on the main equipments for BSc nursing first year who will enhance their knowledge and they can use it in the time of OSCE. So starting on with the session, we will have Miss Linda to present on the parts of the stethoscope. Then over to Miss Catherine, who will be doing on the major the types of the parts of the baby apparatus or sphygmamomometer. Then we have Miss Swati to enhance the knowledge on the major the parts of the Foleys catheter. Then we have Soumya to describe on the different areas where you can palpate the pulse. So starting on with Miss Linda, please start on with the parts of the stethoscope.
Good morning all. I'm going to say about stethoscope.
So can you please come a little closer here?
First, it starts with earbud and the
Earpiece. Yes.
earpiece and the ear tube, and following this it's binaural spring, and it is the stem, and the
Followed by the binaural spring, you have the tubings.
and it is the stem, and stem consists of two pieces. First one is diaphragm and then bell.
Sorry to interrupt, it's not the stem, the chest piece. The chest piece is having two portions. One is the bell, which you can hear all the soft sounds can be heard through the bell of the stethoscope, and all the heart sounds as well as the lung sounds can be heard with the help of the diaphragm. So this is how the parts of the stethoscope looks like. So starting from the earpiece, you have ear tubings, two earpieces and two ear tubings, and this end will be placed onto the ear. Followed by that you have the binaural spring, and then this will be connected to one single tubing. Followed by that you have the stem which is connecting to the chest piece. The chest piece is having again two more parts, which is the diaphragm, and then you have the bell of the stethoscope. So that's all about the parts of the stethoscope. Over to Ms. Christina to explain on the parts of the sphygmamometer.
Good morning all. Now I am going to discuss about the parts of sphygmamomometer, which is also known as BP apparatus. So in top we can see here a screw, and it is known as screw cap, and follow that here the scale with numbers are given. Center to that a tube, glass tube, and inside the glass tube we can see a mercury present in it, and here this part is called reservoir, and inside the metal case we can see cuff which is tied around the patient hand, and these are the tubings, and here it is inflammatory and adjusting knob is present.
So here you have two more tubings, that is one tubing actually the one tubing will be connected to the mercury tank, and this will be during inflation this will enhance this reservoir to fill in with the mercury to the glass tube, and the other end you have the other tubing which is for the nurse to inflate the bladder, and you have the adjustable screw. Just when you hear the systole and diastole, we will be adjusting and finding out the systolic blood pressure as well as the diastolic blood pressure. So that is all about the parts of the sphygmamometer. Next, which we frequently come across the patient bedside, is that all the patients who are bedridden will be needed or who are having any other surgeries in and around the abdominal area. Those cases, unconscious patient, comatose patient, and patient who are at fall risk, all patients will be having the urinary catheter, or you call it as the bladder drainage. So this is the Foleys catheter which will be explained by Ms. Soumya.
Good morning everyone, myself Soumya. So I am going to show a Foleys catheter of size 20 French or 6.7 millimeter, in which outlet of urine once is 30 to 50 ml. So this is the balloon. This is the balloon port, and this is the urine drainage port. And then following that, this is a balloon. So I'm gonna demonstrate how balloon works. So I'm gonna to inflate by using this 5 ml syringe.
You can actually, for demonstrative purpose we are instilling air, but in case of when you catheterize the patient, distilled water is to be used. So just a demonstrative purpose we are using the air. So she is attaching to the balloon port, and you can see the balloon getting inflamed. So the balloon is inflated. Yeah, please describe.
So
Why it is helping, Soumya?
to make sure the catheter is stable in the site, not to slide down from the site area.
So it's actually avoiding the slipping from that particular site, and it is adhering, or it is helping the catheter to place in situ. So for that, or to, you can, in simple terms you can say it is preventing the displacement of the catheter. And the end of the port.
So at the end of the port is bent, and it has two holes on the two sides of the following tubes.
So this is how a Foleys catheter looks like. This is a rubber catheter. You have even silicone catheters if the patient is going to be using the catheter for more than 7 days or so. So thank you for that superb demonstration. And the last one on which we are going to discuss Selvi.
Identification of pulse rate.
Yeah, that will be good for the first year BSc nursing students. So where are all the pulse can be felt?
Good morning all. Today I am saying about identification of pulse. Temporal pulse, carotid pulse, brachial pulse, radial pulse, ulnar pulse, femoral, popliteal, dorsalis pedis, and posterior tibials.
Yeah. So these are the pulse areas. You can just come closer and just look onto it. So she has explained the temporal pulse, which is towards the temporal region of the cranium. Then just followed by that you have the carotid pulse, which is very close to the neck on both bilaterally. The thing is that as a nurse, when we are palpating, we have to do unilateral palpation only, because that is the only major artery which is carrying the blood supply to the brain. And the other pulses such as brachial, it is being felt just very close to the antecubital fossa, and followed by that you have the radial pulse, which is very close to the radial bone, and you have the ulnar pulse very close to the ulnar bone. Followed by that, in cases of if the patient pulses are collapsing, or might be to know whether the blood flow is very good into the lower extremity, then we will be checking the femoral pulse, which is located in the groin region. Then you have the popliteal pulse, which is always felt just back below the knee, at the back of the knee. And then you have the posterior tibial pulse, which is very back at the back side of the foot, and you have the dorsalis pedis pulse, which is placed on the dorsal region of the foot. So these are the areas where we will be using the or identifying the pulse. So you are clear of the random things what we discussed today, such as the parts of a stethoscope, parts of a sphygmamomometer, parts of a Foleys catheter, and the sites of pulse. So you are all clear with that?
Yes.
Any queries do you have?
No.
Okay, thank you so much for your contribution, and thank you for the viewers for watching it very patiently. Please subscribe and follow the channel, and if you have any suggestions or comments, please try to put it onto the comments box. Thank you for your patient listening. Thank you.